So today we're talking to Wolfgang Rathmann from DDZ, the German Diabetes Centre, about the research that he and his colleagues have been doing about COVID-19 and the potential effect on diabetes. So first of all, Wolfgang, could you tell us a little bit about the study and the types of people involved in the cohort and how the data was gathered?
Yeah, sure. Let me start first saying that thank you for your interest in our results. We have used electronic health records from a huge database which included information on about 9 million adults in Germany who visited about 1,200 general and internal medicine practices between March 2020 and January 2021. And we selected all patients who have been diagnosed with COVID-19, and we found a great number, which were about 36,000. And first we looked at the average age, which was 43 years, which was great because this is in the range what we would expect from national statistics. And then we decided to compare the incidence of diabetes after COVID-19 with a cohort of individuals of the same age who were diagnosed with an upper respiratory tract infection, but not COVID-19. And we decided to select this as a control group because we expect them to have a similar approach to the healthcare system like the COVID-19 patients. But in addition, we further matched the cohorts to make them more comparable by matching for sex, for health insurance, even for month of diagnosis, and some risk factors included in the database, including obesity, high blood pressure, high cholesterol, and previous heart attacks and stroke.
Well, that sounds like a very comprehensive data set, and must be a good example to be able to extract some interesting data. So what were your main findings from the study?
Yeah, so we found that new cases of type 2 diabetes were more common in patients who tested positive for COVID-19 compared to those with the upper respiratory tract infection. And to give you some numbers, the type 2 diabetes incidence rates were 15.8 per 1,000 people per year after COVID-19 compared to 12.3 after respiratory infections. And this gives, we always like to calculate some comparisons in epidemiology. So we compared these two rates, and this gave an incident rate ratio of 1.28. In simple terms, that means that the relative risk of developing type 2 diabetes was 28% higher in the COVID group. And to interpret this, I think that type 2 diabetes is not likely to be a problem in the vast majority of people who had mild COVID-19, which is our study sample. Most of them had mild forms of COVID-19. They don't need to go to the hospital. But still, we recommend from this data that anyone who had recovered from COVID-19 should be aware of warning symptoms and signs of diabetes, such as, fatigue, frequent urination, increased thirst, and seek diagnosis and treatment right away. And the problem, in my view, is that people who suffered from COVID-19 might attribute such symptoms to their COVID-19 disease and not to diabetes.
They could be considered to be long COVID, perhaps, because the symptoms of long COVID are so poorly understood as yet. So it's very interesting to be able to draw that distinction. Did you look at type 1 diabetes and other forms of diabetes as well?
Yeah, we did. The problem with the database, although we used a huge number of patients, is that we did not find enough cases of type 1 diabetes in our data. So we made some calculations, but these were based on too few cases. We did look at other forms of diabetes, which are not so seldom as you would think. And we were not able to find an increased risk for other forms of diabetes. So it was mainly attributed to type 2 diabetes cases.
Oh, that's interesting. And do you have an idea of what the mechanism might be, either from your own work or from the work of some other groups around that have been looking at this?
That's a very important question. And my personal opinion is that based on previous research for many people, that we know that COVID-19 lead to an upregulation of the immune system, and this persists even after remission of the disease. And we know also that inflammation interferes with pancreatic beta cell function and may be a risk factor for insulin resistance. So this could be an explanation for the association we found. But there are many other factors that we thought of. One is that we know that during the lockdowns, people were more used to a sedentary lifestyle, and we all know that this can increase type 2 diabetes risk. Another explanation that I'm thinking of is that people who might already have been at risk of developing diabetes due to having obesity or even pre-diabetes before they got COVID-19, and the stress of the infection speeded this process up. So we were not able to further distinguish these potential explanations from our database, but I think many people worldwide are now working on this issue, and I expect some interesting data to come up during the next weeks or so.
That is interesting. That's certainly a tricky problem to untangle. Are you planning to extend this study to extend the follow-up time for this cohort at all?
Yeah, we are planning to do additional analysis of our database with longer follow-ups. We also are looking using a different database on all new prescriptions of insulin in children and young adults in Germany, and we will compare this with rates of COVID-19 provided by the Robert Koch Institute. And we are also looking at the effects of COVID-19 vaccination on diabetes. We will use something that is called a self-control case series. So each person who received a vaccination served as his or her own control, and we will compare diabetes incidence after and before the vaccination. So this is the work that we are doing.
Oh, that sounds fascinating. So, and are you drawing a distinction between the different kinds of vaccine, or vaccinated versus non-vaccinated?
Just vaccinated versus non-vaccinated.
I think we've all become vaccine specialists over the last 2 years, haven't we? So
exactly, yeah.
We all think we know a lot about them.
Yeah, but I think there are many more questions, and if I may add this, just to say, from our study, it is really unclear whether we found pre-existing diabetes who just became apparent during COVID-19, which is due to more diagnostic tests or so. That is one important point we could not figure out. Second, as you already mentioned, we only had a follow-up of 4 months. So we need longer follow-up times to see if this, I would call it a post-COVID diabetes, may be reversed.
Yes.
Full recovery. And third, from a clinical point, I'm not a clinician, but from a clinical point of view, I think it's very important to understand how we should treat diabetes, new onset diabetes after COVID-19. So far, we don't have any data on this. And finally, from an epidemiological point of view, I would say that the change in glycemic measures like glucose and HbA1c after COVID-19 is most likely on a continuous scale, which means that such risk factors, like I already mentioned, like inflammation or changes in health behavior, make a shift of these measures in patients to higher levels. Due to the database, we were not able to investigate this, but I know that some people are already working on this, and this will be very important to see. Is this really something that is shifting or making a larger deterioration of diabetes? So we need much more data on this issue.
Well, it's a very exciting field of research. And do you have any, in the interim, whilst the number crunching is still carrying on, do you have some messages for public health authorities in different countries of how you would like them to react to this information?
Yeah. Well, I'm a diabetes researcher for more than 2 decades, and I believe now that public health authorities worldwide need to refocus on the disease we are fighting, the diabetes pandemic. And you probably know these figures from IDF that currently it is estimated that we have 537 million adults worldwide who suffer from diabetes, or about 1 in 10 of the world population, which is tremendous. And diabetes is one of the most frequent causes of death worldwide. Every year we estimate that 6.7 million people die as a result of diabetes. Even though diabetes is not directly fatal, such as COVID-19, its long-term complications place a great burden on individuals and also on societies. And in my view, it is important, how does this compare to the burden of COVID-19? And we do not fully understand this, but current estimates from WHO say that COVID-19 caused probably a similar number of deaths as diabetes worldwide. And I really don't want to downplay COVID-19, but for me, it's astonishing how much people fear a largely unpredictable infection such as COVID-19, and in the same way underestimating the severity of a well-known disease like diabetes. We know that diabetes limits life expectancy to those affected and is a major burden also in economic terms on societies. And similar to COVID-19, it's spreading worldwide. So my main message is we now need to refocus on the diabetes pandemic, not only focusing on COVID-19.
Oh, that's very interesting. Thank you. That's really given us a good insight into your research and to how things are progressing from here. So thank you very much for your taking the time to talk to us about this.
You're
Thanks.
very much welcomed. Thank you.